Welcome to the Global Learning Office's GLOVicariously webinar series. My name is Sarah McGuinn, and I'm a Senior Program Manager in GLOW, and I will be getting us started today. So today's topic is gender equality in post-colonial societies, the impact of HIV/AIDS, COVID-19, and gender-based violence in South Africa. So thank you again for being here. So first, a couple of housekeeping points. This webinar will last approximately 1 hour. We'll have a presentation followed by Q&A. All participants will remain muted, so feel free to send in any questions to the chat Q&A, and then we'll collect them to answer at the end of the presentation. Today's webinar is being recorded, so you're welcome to keep your cameras on or keep them turned off, whatever you're most comfortable with. And then we will also launch a quick poll at the very end of the webinar. So I have the honor and pleasure of introducing today's speaker, Professor Amanda Gouws. Amanda Gouws is Professor of Political Science at Stellenbosch University in Stellenbosch, South Africa. She holds a research chair in gender politics, and her research focuses on women in citizenship, the national gender machinery, women's representation in government, and sexual violence. She has published widely in these areas. In 2017, she co-edited a collection of short essays written by feminists from around the globe about the women's marches after Donald Trump's election as president of the USA. The book, entitled "Nasty Women Talk Back," gives voice to women's resistance against and anger at Trump's election. She's the editor of Unthinking Citizenship, Feminist Debates in Contemporary South Africa. In 2012, she received the Wilma Rule Award for Best Paper at the International Political Science Association Conference in Madrid, Spain, in the category Gender and Politics, with the title Multiculturalism in South Africa, Dislodging the Binary Between Universal Human Rights and Culture and Tradition. Her co-edited book, Gender and Multiculturalism, North and South Perspectives, was published in 2014, and she was a commissioner for the South African Commission for Gender Equality from 2012 to 2014. So Amanda, thank you so much for being here with us today. And with that, I will turn it over to you.
Thank you, Sarah, and good evening, everyone. I see some faces I recognize, so hello to my old students. It's great to see you. Okay, so thank you for this invitation. And I thought, when I was asked to do this webinar, what shall I talk about? And I think it's apt that we sort of reflect on basically what happens in post-colonial societies when pandemics hit them. And South Africa has had to deal and is still dealing with, at this point, the compounded effect of HIV/AIDS and COVID. And then we need to think of the gendered nature of the implications of both pandemics. So I'm going to talk first about, gender equality when we sort of moved from the apartheid state to a democratic state, and then I'm going to talk about HIV/AIDS, COVID, and we can actually call the very, very high levels of gender-based violence in South Africa another, an epidemic, because you'll see the statistics, it's quite frightening. So I'm going to talk about all three of these issues and what it means in this specific historic global moment. So I'm going to share the screen now so that we can see. I've made the PowerPoint slides. There we go. Could everyone see that? All right. So I think post-colonial societies, of which there are many, and I think in a sense the United States is also a post-colonial society. But in South Africa, where we have the situation of, there's the structural inequalities that is a consequence of colonialism, combined with social marginalization and exclusion of the indigenous population. We need to keep that in mind when we talk about these issues that I want to talk about. So the legacies of both colonialism and apartheid endure. And so we are actually more than 20 years after democratic transition, we are dealing with those legacies. And we very often do not pay enough attention to the gendered nature of post-colonial societies. Now, South Africa is a very peculiar post-colonial society with peculiar conditions caused by apartheid racialization of the society. And what that means is that, you know, in the US, you also experience, I think, issues of race and racism. But what we did in South Africa was to turn it into laws and legalize everything from movement, from who people could marry, who they could have relationships with, where people could live, and so on. And those structural inequalities have remained. And the other issue that was very peculiar about the South African conditions was the racial hierarchy, with a minority group, white South Africans at the top, and then below them mixed race, and below them Indian South Africans, and below them Black Africans, which really means that is how the society operated. That by the color of people's skin, they had more privileges or less privileges. And so what that also means is that if we look at that hierarchy, and we've tried in the past 20 years to actually invert that hierarchy, at that point, it was Black women. If we talk about intersectional identities, it was Black women who were at the bottom of the hierarchy. And if we look at it now, it's still the case because of the lack of opportunities. So that is part of the gendered nature of the legacies of apartheid. Now, I think very often what happens is that we talk about this and we position, or we talk about women only as victims. Excuse me, but we also need to understand the intersectionality of identity. So if you, for example, an African rural woman, you will have probably worse conditions than if you are middle class, an African middle class woman living in a city. So we need to keep in mind how those intersectionalities of race, class, gender, and sexuality position people post-1994. So we are the most unequal country in the world, and I'm coming back to that, the consequence of its colonial and apartheid histories. And so we see that, that the transition from apartheid was viewed from the perspective of the ruling party as a liberation struggle to liberate the country from racism and racialization. But not necessarily a gender struggle, even though women struggled alongside men. So it sort of put women's oppression in the margins of that liberation struggle. And it took women to actually take the agency and fight patriarchy. And this happened with a big national movement called the Women's National Coalition. That was an alliance of feminist activists, academics, and women's organizations. And what the coalition did was to actually take that window of opportunity that was presented at the time of transition to put women's issues on the agenda and into the negotiation process. And that actually did contribute to also give the gender struggle some visibility. One of the things that the women's movement campaigned for was a quota to get women into parliament. And they managed to get a 30% quota with the help of the ANC Women's League. The ANC is the ruling party in South Africa. And then they decided that, you know, they need to write a women's charter, which is like a Bill of Rights, but for women. So they consulted over 1 million women, which I think was an amazing feat because that happened in about a 3-month period. And then what they managed to do was to get the non-sexism clause included in the Constitution, because right in the preamble of the Constitution, it says South Africa is a non-racist, non-sexist society. And it also included 5 grounds for non-discrimination in the Constitution. There are 17 grounds, of which race, of course, is an important one. But then the 5 that's linked to gender is sex, gender, the construct, sexual orientation, marital status, and pregnancy. And so that actually is very important because it has now got constitutional protection. And then it creates these structures in the state called the National Gender Machinery, of which the Commission for Gender Equality is written into the Constitution. The other structures are not, but it's very important that the Commission for Gender Equality is also a constitutional body. And then in the first 5 years, of course, the women who went into the parliament on that 30% quota wrote many important, what we call women-friendly laws. So it's the Domestic Violence Act, the Sexual Offences Act, the Maintenance Act, the Choice of Termination of Pregnancy Act. So right from the start, we legalized abortion. And I think if today you would ask, if you would have a referendum in South Africa on abortion, then most people will be pro-life, because we are a very religious country, and I always say we're probably one of the strangest countries in the world. We say we're so religious, but we're also extremely violent. So there are lots of contradictions. Now, the Constitution includes formal and substantive equality rights. So the formal rights are your civil liberties, you know, the right to, well, the freedom of speech, association, movement, and so on. But substantive equality rights, of course, puts a burden on the state to enable these rights. In other words, the state will have to pay for some of these rights, like the right to education, the right to housing, the right to a job. So this, at that point in the negotiation process, the argument was made that that would not be possible. So how it's written is that you have the right to access to education and the right to access to health. So the state makes the access possible, but that doesn't mean you're going to get it for free. And I think there's always been a big tension between you know, the formal rights and the substantive rights, and the willingness of the state to actually enforce the implementation of substantive rights. And I'm coming back to that because it has you know, an impact on how we view health rights. So the two important substantive equality rights are health and reproductive rights. Now, we have a two-tier health system in South Africa. We have private healthcare and state healthcare. And private healthcare, of course, is very, very expensive and getting more expensive every year, because the people who can afford to pay for healthcare is a small minority of people that are in the middle class or the upper middle class. Other people, and specifically poor people, have to go to state facilities, and these state facilities have become very neglected over the last 20 years. So we've seen incredible burden on doctors who work in state facilities because they don't have the necessary equipment, they don't have the necessary medication, and this has become a crucial issue now during the COVID pandemic. Now we have also a huge impact of disease on the majority of South Africans, like HIV/AIDS, sexually transmitted diseases, obesity, and diabetes. There are many, many people in South Africa who are obese, and that's not because they have you know, a middle-class lifestyle. It is because they're poor and they eat a carbohydrate-rich diet. So porridge 3 times a day, and that is, you know, it's not a balanced diet, but it leads to obesity, and that also leads to diabetes. So, and these conditions now are comorbidities for COVID. So a comorbidity means that if you have those diseases, your risk of dying when you get COVID is much higher. Then we also have to consider the impact of cultural practices as well as gender-based violence. And I want to start with this question: how do governments in democracies relate to matters of science? Now, I think I watch CNN at the moment mostly daily, and I am quite taken aback by the way that your president deals with this pandemic in terms of his not believing the science. And he is not the only one, because in South Africa, when the AIDS pandemic was at its height in the early 2000s, we had the highest infection rate in the world. And we had a huge struggle to get the government to engage with the science of HIV/AIDS, and as well as the research by medical scientists. So in the face of evidence of medical research, our president at the time, President Thabo Mbeki, did not accept the results of science. So he is called an AIDS denialist, and he rejects the relationships between the virus and the disease. In other words, if people get AIDS, the argument was that it's poverty that causes AIDS. Now, of course, we know poverty can't cause a disease, but what this means is that poor people are more likely to contract HIV/AIDS because their immune systems are already compromised. But you know, it's still due to the virus, but that link was denied. And the reason for that is that President Mbeki is an Africanist, and he did not want the world to think of South Africa, and specifically Africans in South Africa, as promiscuous, because that is a colonial stereotype of Black Africans, that they are sexually very promiscuous. And he actually said this at a conference, that this is how the world thinks about us, that we're promiscuous germ spreaders, and this is not true. So you know, he therefore came at it as an Africanist. But of course, this caused huge problems in the sense that he, for example, stopped the mother-to-child transmission programs. And what we saw with those programs is that when women go into labor, if you at that point give women one antiretroviral pill, it would stop the transmission to the baby. But the president did not believe this. So already there was a huge problem, because not only did women get the virus in larger numbers than men, but also that they then transferred it to their children. So the president refused, and the government refused, to roll out antiretroviral drugs. And it is estimated now, looking back at that specific time period, that 300,000 lives could have been saved if we rolled out antiretrovirals sooner. So it was only when President Jacob Zuma came to power, who was, of course, also a very problematic president for other reasons, but he rolled out the antiretroviral drugs then, and soon after that, we could see the infection rate stabilize and stabilizing. The point is that we have not managed to develop a vaccine yet, and in other words, we have over 7 million people living with HIV/AIDS, and that we still see that the infection rate, that the infection continues. So it's still transferred between people. And we haven't managed to actually get rid of the HIV virus. Now, of course, this virus is not as lethal as COVID because of the way it spreads. It spreads through sexual intercourse and blood. But if you're careful and you take the necessary precautions, it's not that lethal, and people can live with HIV/AIDS for very long periods of time, for over 30 years for that matter. So there is our famous South African cartoonist, Zapiro. This cartoon is the Dissident's Highway. So HIV doesn't cause AIDS, no to AZT. AZT was the first type of antiretroviral. Ignore scientific evidence and visit wacko websites. and it says we have to explore all the avenues. So the health minister at that time, Tshabalala Misimang, her suggestions for the cure for HIV/AIDS was beetroot, the African potato, and garlic, which of course was an attempt to focus on nutrition. But when the South African delegation went to a global AIDS conference in Toronto, South Africa was the laughing stock of the world, because the countries had at their stalls all kinds of ways that they dealt with AIDS, the equipment and stuff. And at the South African table, there was a basket full of beetroot, African potatoes, and garlic. So you can imagine, how the world looked at this, and how we were ridiculed in many ways. So HIV/AIDS carry a huge stigmatization, and it's because of the way it is spreading through sexual intercourse. So people do not want to disclose, and very often people practice unsafe sex, and that is why we still see the spread of the HIV virus. The Deputy Minister of Health, Matlala Rutledge, at the time, actually was brave enough to oppose Minister Mbeki. She actually went to an AIDS conference in Spain when he said to her that she couldn't go. And then when she got to the other side, she was told to come back immediately. And when she landed at the Cape Town airport, he fired her right there at the airport. So he did not, tolerate any criticism. But what happened was that there was then a shift to the focus on male health, and male circumcision then became one of the ways of preventing the spread or lowering the spread of virus. And I'll come back to that. Now, the gender dimension of AIDS, if we look at sub-Saharan Africa, you have 70% of all the AIDS cases in the world live in sub-Saharan Africa. And one of the main contributing factors to that is that men have multiple sex partners. This is an accepted practice. Women don't. And it's really frowned upon if women do, but men have while they're married, they may have multiple sex partners. And then they refuse to practice safe sex. So one man can infect more than one person, more than one woman. So what we also see in South Africa is the rise of transactional sex, and it's called the Blesser phenomenon. So if you are a young woman who aspires to be upwardly mobile and have aspirational lifestyles for luxury goods like cell phones and computers and so on, these young women enter into relationships with much older men who can provide this. But then one of the trade-offs is that, for example, no condom use. And that also, contributes to the spread of the virus. Because it's also, people women who are not in positions of power, and these are very often married women, cannot negotiate safe sex. It's not tolerated. And that's also a big problem. Then what we have found is that in South Africa, very many women get the Depo-Provera implant as a form of birth control because they cannot access medicine once a month. And that has made them more vulnerable for contracting HIV. People who suffer from STDs also more vulnerable, and then it also contributes to maternal mortality. So we have one of the highest maternal mortality rates in the world. The current infections, and this is new statistics, April 2020. The AVERT report, and AVERT is an online platform that collects statistics. is that 140,000 women versus 86,000 men became HIV positive in 2018. So you can see it's nearly double for women. In the same year, 4.7 million women were living with HIV compared to 2.8 million men. And the prevalence of HIV among women is 4 times higher than men, with 540,000 young men living with HIV compared to 180,000 young men. That's under the age of 25. So a longitudinal study with a cohort of young women showed that intimate partner violence and unequal power relations contribute to the likelihood of contracting AIDS, and the probability is 1 in 4. Then if we look at the role of culture, right? There are certain cultural practices, and let me say that there is also a lot of action and activism by women against these practices that they see as dangerous. One of them is virginity testing. So and virginity testing actually wasn't practiced anymore, but when we started getting the high rates of HIV/AIDS infections, it was brought back into practice. So the elder women in the communities will actually look at the hymens of young women to decide whether they're virgins or not. And of course, those women are then marked as virgins. And of course, there's also in South Africa the virgin myth, the myth of sex with a virgin, which means that men believe that if you have sex with a virgin, you will be cured of AIDS. So it sets these women up for rape. And then a couple of years ago, the ruling party decided that they will give virginity scholarships to women. So young women who were students, if they could show that for every year that they studied, they are virgins, they could keep their scholarships. Of course, there was a huge outcry against that because it puts the responsibility for reproduction on the shoulders of young women, right? They have to be safe, they have to ensure safe sex, and there's no responsibility on young men to do the same thing. So in South Africa, the spread of HIV/AIDS is heterosexual, through heterosexual sex, and as I've mentioned, the issue of multiple sex partners. Then there's ukuthwala, which is also an old practice, but the origins of this practice was when a young man and a woman wanted to get married, he will abduct her, take her to his family, and they would care for her while he actually negotiates the bride price. But this is now morphed into something else, which is older men and sometimes very old men abducting very young girls and then, of course, raping them. And very often these girls, when they are found, test positive for HIV. So, you know, I think the issue here is that, and this is the book that was mentioned, this lodging the binary between culture and rights, is how do we go about this in sensitive ways, not to blame culture, but to find ways to change culture in a way that it still keeps that importance for people who are part of that culture. And that of course is very difficult, but also possible in the sense that if you can get people to critique the culture from the inside and suggest changes, and also through education, then the impact on culture is not that big as though it would be criticized from the outside. Now back to the issue of male circumcision, because that's also a cultural practice, but how it's done in South Africa in the traditional way is that young men go into the bush for a month or more, and they are circumcised by traditional healers. Very often those healers have no medical training. So what we see each year is that the risk of dying from male circumcision is very high. Between 60 and 80 young men die every year from circumcision. But the prevention of HIV/AIDS, the argument was made that there are receptors in the foreskin that are more receptive to the virus. And so if you have circumcision done in a hospital or by a medical practitioner, that lowers the risk of HIV/AIDS, and that is true. But the negative impact of that for women is that a lot of the funding that was entailed for research on women and HIV/AIDS and women was redirected to the research on men. And it also reinforces certain scripts, gender scripts. So, you know, men are seen as then the ones who are engaging with a different form of culture, and women are seen as closer to nature, and because of their menstrual cycles, they are seen as dirty and the spreaders of the disease. That's one of the gender scripts. And it also makes men believe that they do not need to use condoms, which I guess has really had an impact on the campaign around condoms for safe sex. And of course, there's no guarantee that they won't contract the virus. It just lowers the risk. Now, if we also look in, you know, what happens then if people get very sick, what we call full-blown AIDS, it puts the burden of care on women. We have done a study, I've done a study with one of my PhD students on home-based care workers, because once a person develops full-blown AIDS, they cannot stay in hospital because there's no resources to deal with the numbers. So they get sent home, and then home-based care workers need to look after them. Now, most of the home-based care workers are women, and many of these people live, you know, people who have full-blown AIDS come from, often they come from poor communities where you don't have the necessary protective equipment. And what our study has shown, we've done 3 communities, is appalling conditions: no gloves, no masks. They work with bodily fluids, they work with blood. And they are actually contracted on short-term contracts by the state, but the state pays very irregularly. So they have to use their own meager resources for people, you know, when they actually care for people with full-blown AIDS. So they are actually exploited by the state. And we have documented, you know, this very well in the study that we did. The issue of gender-based violence. Now, in South Africa, we have on average 50,000 reported rape cases per year, and the majority of the perpetrators are known to the victims. And we see that research shows that women who are in relationships that are violent have a greater chance of contracting HIV positive if the partner is positive, because it's also the involvement of blood, not only sex, but you know, when there is violence, there's blood. A study by one of South Africa's gender scholars, she's a medical doctor, Rachel Duke, showed that many women become HIV positive within 2 years after becoming sexually active. And the sexual debut of girls now as young as 11 years of age. So it's, you know, I think the younger girls are the more likely that they can, that they will contract AIDS, because they have very little negotiation power in relationships. The accounting firm KPMG, is an international firm, did the cost of GBV to the South African state, and that's between 28 billion and 42 billion rand per year. The amount varies because it depends on what happens in the different provinces. But you can see that is an enormous amount of money that can be saved if we are more proactive in dealing with gender-based violence. So, you know, the cost that in the KPMG study was the medical cost of injuries, sustained court orders, moving people out of their houses, lawsuits, and all kinds of other costs. The problem is also that the state does not give proper funding to shelters for domestic violence. And we've also, when I was a commissioner for the Gender Commission, we did a study, a costing study on what shelters should, what a woman and children in a shelter should get per day. And it came to around 300 Rand per day, while the state only pays 33 Rand at that time when the study was done for shelters. So it's another huge problem. Now, in poor communities, women often turn to survival sex or sex work. And there's a debate about how should we deal, you know, what should the policy around sex work be? So there's criminalization, which means it's completely illegal, or partial decriminalization, which is the Swedish model. You decriminalize the demand. In other words, men who want to buy sex, or you legalize it, which means there are certain regulations, and decriminalization means that you don't see it as a crime anymore, and it's then regulated by other legislation, like, for example, labor legislation, because it becomes like a job. Now the Commission for Gender Equality has recommended for years now decriminalization, but Parliament remain with their policy of criminalization, or it's illegal. And that makes sex workers very vulnerable because they don't have protection and they cannot negotiate condom use. So they are also very vulnerable to contract HIV/AIDS. Now let's turn to COVID then. What COVID has done, I think, for all of us is to show up for all countries, is the global inequalities. South Africa's Gini coefficient is 0.68, which is the highest in the world. Now, what this coefficient means is the closer it gets to 1, the bigger the inequality gap. But what we did, and here the government did actually react to science and research, and also to looking at the experience of other countries who got the COVID virus before we did, is to go into a hard lockdown in March. And now we've been in a hard lockdown for 124 days, although it's come down from level 5 to level 3, which allows now some economic activity, and also people are allowed to go to restaurants, but you have to do social distancing. So the problem is balancing economic demands with keeping people safe. But the economy was already in bad shape in March, right? We were downgraded by the international grading agencies to just above junk status, which of course had a huge impact on investments in South Africa, and that led to job losses. And this is now aggravated unemployment, right? It went up, well, in March it was 27%. But if we also count people who stopped looking for work, it was 42%. And by all accounts, when we finally get out of this lockdown, which we don't know when that will be, it will be close to 50%. So that's half of your working population. In the past 3 months, we lost 1 million jobs, and that's mainly in the tourist, restaurant, short-term contract industry. So what is the impact of COVID on women? Now, it's very difficult for women to do social reproduction. What that means is the care work needed to reproduce the next generation, but also to do care work of a different nature, of looking after elderly people, of looking after preschool children and so on. If you don't have the resources to do that, it becomes a huge problem. And after the lockdown, the care burden at home, of course, increased because schools closed, and now people have to do homeschooling, and that burden falls mainly on women. And of course, that means that these are women who have access to the internet, who have access to computers and so on. And a large percentage of our population doesn't have that. So that's also a huge problem. Many people are so poor that they now face starvation. And I mean, I find it really very scary. Now when I go to the grocery store, in the past, you had beggars in front of the store. That was, we have a lot of homeless people. But those numbers have more or less tripled. So you see people on the street begging for food. Now, many women work in the informal economy. What that means is they would sell stuff on the street, food, crafts, all kinds of things. And so they work, their sort of selling points are on the sidewalks. And now, of course, there are no people outside to buy things. And that has really hit them hard because the statistics for women in the formal economy is much higher than for men. Now, children had feeding schemes at school, but if they don't go to school, they don't get food. So that is a huge problem as well. And then we see domestic violence has increased dramatically. Because women are now trapped with abusers in the same home and they can't go anywhere. First, under levels 5 and 4, no alcohol could have been sold. But when we moved to level 3, which was about the beginning of June, alcohol was allowed to be sold. And then we see a huge increase in alcohol-related violence that then ended up in the emergency rooms of hospitals. And then the government looked at this and said, okay, we cannot have COVID and deal with these types of injuries at the same time. So they again banned the sale of alcohol. Of course, there was a huge outcry about that. The point here is that you cannot blame violence on a single cause, like saying men are violent because they drink. Men are violent when they don't drink. So violence is not the only cause, but it is now portrayed as the only cause. And I hear noises of prohibition coming from the government, which I think is problematic in a country that has one of the, the economy depends on the wine industry, for example, especially in this province. So you can see there are all kinds of things going on that try to contain violence, but not in the right way. And this has also very serious economic implications. For those of you who've been to Stellenbosch, the estimate is now that at least 80 of the cellars will have to close down in the near future. How do we deal, and I don't want to take up much more time, but how do we deal with COVID? So HIV/AIDS is a comorbidity, but this time the government listened to the science, right? Sorry, I forgot to switch off my phone. Sorry about that. So when it, the fact that it's a respiratory disease and that it is highly contagious, that was all accepted. But after 6 weeks, Glenda Gray, who heads the Medical Research Council, and she's one of the 100 most influential people in the world, according to Time magazine, said that a lot of the regulations that government has put in place doesn't make sense. For example, the major form of transport in South Africa is the taxis. So the taxi industry is very strong and they refuse to do social distancing. In other words, they could not load to full capacity. They just said we're going to lower to full capacity, which means people are really sitting very close to each other. And the government then said, no, it's fine. People can do, taxis can load to full capacity as long as they open the windows. Now you can see that makes no sense. And again, we see a backlash from government and from the Medical Research Council, who then said that she embarrassed the government and that they're going to do a formal inquiry into her, what you've said. So, but the longer the lockdown goes on, the more doubt people start to doubt that it's really based on science. And actually, it's more about economic measures now that's portrayed or masqueraded as science. And I want to end here with the issue of bad public health. So where I started to say that the public health has been really neglected, and we've seen a week ago on BBC television a video that was made about hospitals in the Eastern Cape, which is another province, showing patients fighting for oxygen, soiled linen, and blood on the floors. And really the medical staff say it's so unsafe, they don't want to work. So some of them just don't come to work. So it's a total crisis. And specifically for pregnant women, their health's compromised. And I just want to show you, that's the kitchen in one of the hospitals. And that's one of the beds also with used protective equipment on, and no mattress on the bed. Intimate femicide in South Africa is 5 times higher than the global rate, and that's women getting killed by their intimate partners. Now, we've had very serious situation right before lockdown, and then we didn't hear anything during lockdown. And the first week of level 3, there were 3 gruesome murders of men killing their partners in very brutal and gruesome ways. And the estimate is now 21 women die per week from femicide. So if we look at all of this, we see that in the 30 years after AIDS was named as a treatment and started, women still get infected and die in larger numbers than men. And we see that many people are also too poor to take antiretrovirals, because you cannot take those medicine on an empty stomach. It's just, people who take them say it's absolutely impossible. And what it leaves us with are also children-headed households where both parents have died from AIDS. And what we see with COVID is that resource scarcity and hunger has a greater impact on single-parent, women-headed households. And that's the norm in South Africa. We are not the nuclear family with a mother, father, and children. So households headed by women. And then South Africa suffered from both pandemics at the same time. And that is a compounded effect that has really serious implications for women. So there are all kinds of activism. I'm not going to go into that, but to say that hashtag total shutdown shut down the country in 2019. And what we now have is at least a national strategic plan on gender-based violence. And that was to get the government to pay attention to intimate femicide. And I thought that was really a nice poster, Intersectional Activism. Black Lives Matter, science is real, women's rights are human rights. No human is illegal, water is life, and kindness is everything. So I'm going to end it there. Thank you.
Wonderful. Thank you so much, Amanda. This was amazing. So we can, let's see, let me do a quick time check. We've got about 10 minutes, 9 or 10 minutes for questions. So just as a reminder, in the chat in Zoom, everyone is welcome to send in questions to Jessica, who is listed as Q&A. But so we've got a couple at least to start off with. So someone's asking about if you could speak a little on the future of South Africa. Like, for example, do you think that eventually leadership could be more responsive to so many of the issues that you just presented here? And what could this look like in, you know, post-COVID times?
Well, you know, I think we were quite optimistic in the beginning of the pandemic, and I mean that's so contradictory to say you're optimistic and you're dealing with the pandemic. But it was as though we've put our political differences on the back burner, and they were really acts of kindness among people, caring and sharing and sort of helping each other. But I think, you know, that was just, I think, a naive perception that, you know, COVID will change the way that the ruling party works. And we've seen coming back to level 3 that there is a lot of fighting going on. And this has been the problem with the ANC all along, is that there are different factions in the government, and the president is in one faction, but the person who is the minister of cooperative governance, she is the ex-wife of Jacob Zuma, and she's in a different faction, and she makes the rules. And one of the rules, for example, is that no cigarettes will be sold in this entire lockdown. There's no really proven evidence that if you stop smoking after you've smoked for years, that you will be better off when you contract COVID. But she is making a point about smoking, and that has cost the government 5 billion rand in sin tax, which is the tax that they levy on cigarettes, as well as excise tax, billions of rand in excise tax. So economically, it makes no sense. So you can see there's a difference of opinion there in government. I think the fact that we struggle so to deal with gender-based violence, and that we now, you know, see these incredible brutal femicides, is that, again, the government and the women, and here women in parliament, we have nearly 50% women in parliament, so one of the highest numbers in the world. Why is it that this is not on the agenda of the women in parliament? Why is it that they so struggle to actually come up with preventative measures for violence? Because you cannot. I mean, the policy now is punitive, right? You arrest somebody and you have a court case, and then the slogan of the ANC is rapists must rot in jail. But that's dealing with one perpetrator at a time. So we have to work proactively, and there is no really proactive measures. So post-COVID, I'm not sure that things will improve, because what we now will have is a country where you have 50% unemployment, you have incredible inequality and poverty, and maybe people won't, you know, the contraction of the economy means that you won't be able to go and find a job somewhere, because there will be no jobs to find. And this, I think, is going to lead to incredible tension, and then we see the cycle of violence again. So, yeah, I'm not very optimistic.
Thank you. One more, and this one might be a bit much to tackle in the 3 minutes that we have remaining, but I was curious about when you spoke about trying to change culture, and that the best way to do that is not by applying external pressure, but through education and things that would allow cultural change to happen from within. I was just curious if you could give a couple of examples of initiatives that you've seen work that follow that
yeah, for example, women are not allowed, women who live under customary law in rural areas that are governed by traditional leaders are not allowed to own land. But what happened was during the process of colonization, oral traditions were they were codified into law. So they become very static, which means that the culture didn't change because the law didn't allow it to change. But if we talk about living customary law, we've seen that some traditional leaders give unmarried women and people who cohabit, who are also not allowed to own land, they give them land and to work on and to live on. And then you have traditional leaders that really stick to the codified law and said absolutely women can't own land, can't have land. And you see the difference, and there's studies done that looked at different communities, and you see the differences in those communities where you have traditional leaders that are more lenient and allowing women greater equality and access to land. So it is possible, but it's also a problem that only men are traditional leaders. There have been many court cases that showed that women taking who were actually supposed to become traditional leaders, who were prevented, taking the situation to court and then winning the case, that they are in terms of the inheritance law, that they are actually valid traditional leaders, but it is actually really opposed by male traditional leaders.
All right, thank you. And well, that was perfect timing, actually. It is 1 o'clock. So we would just like to thank you again for your time and for being here and for sharing all of your knowledge with us. So another round of applause for Amanda Gouws. Thank you, everybody, for being here. Amanda did say, we see that there are quite a few public health and development alumni on the call. So Amanda graciously said that she could hang around for a few minutes if anybody wanted to stay and say hello. And a quick shout out then for next week. As you all know, this GLOVicariously series is happening on a weekly basis. We hope that you'll come and join us next week for the talk entitled Borders, Commerce, and COVID-19, the Tense Relations Between Costa Rica and Nicaragua. So for anyone that's not sticking around, thank you so much for being here. Enjoy the rest of the day.